Friends and family, welcome to another live broadcast brought to you by Premier's Turning Point, with your host, Bishop Dr. Uton Lang, and co-host, Overseer Franklin Williamson. We pray and hope that something that is being said today will bless your soul and spirit. Please take a quick moment to like and share this broadcast with your friends and family. Thank you again for joining us. Let's go into our live program.
Good evening, one and all. This is Bishop Dr. Uton Lang, and you're on another time with us on Premier's Turning Point. It's wonderful to have each and every one of you joining us this evening. And as we continue our programming from last week, this is Breast Cancer Awareness Month, and we're spending some time just to make sure everybody is up to speed and well educated on the topic. We are excited because, when we share, we are giving out valuable information that you could, make sure that you're in tune with what is going on. And breast cancer is one of those important subjects. And because if with early detection, there's a lot more that we can do. You're going to hear a lot more. We have two special guests this evening, and I'm going to have them introduce themselves in 1 minute. And of course, we have our co-host, Overseer Williamson, and he is on with us. And we're just going to have a time with you. We know that God will lead and guide as we further this discussion. So without further ado, we're just going to have Overseer just said hello, and then we'll go right into our guests.
Thank you, Bishop Lang. I'm so excited. I'm so thankful to God that He has afforded us yet another time for us to be here just to educate our community. This month is Breast Cancer Awareness Month, and to be quite frank, 1 month does not do sufficient to learning about this deadly disease. But here we are. We have a very good panel ready for our discussion today, and I'm delighted. Please share this, like this, tell your friends so they can interact with us live on Premier Turning Point. God bless you. Back to you, Bishop.
Well, we have, as I said, two awesome guests, and we're going to start out them introducing themselves. And I think Felicia is going to go first, and then we'll go from there.
Hi, good evening. My name is Felicia Briggs Herbert, and I am a family nurse practitioner. I've been a nurse for over 31 years, and the last 14 years of which have been as a family nurse practitioner. And I worked with a breast surgeon for a couple of years, and I'm so excited to be able to share some information with you about this important disease that affects so many women. Thank you for allowing me to be a part of this panel.
Good. And we have Jennifer.
Yes, hello everyone. Thank you so much, Pastor and Bishop, for inviting me to be a part of the panel. It is always my pleasure to share. I'm very passionate about this topic, this disease, and I hope that this evening, from my story and my experience, someone will take the necessary action to, save their lives. Thank you.
Right. So we thank you. We really appreciate our guests this evening. And what we want to say to everybody out there, this is a good time for you to share with your friends that we're on. And of course, if you have any specific comments or questions, you can do that either on Facebook or on YouTube. And we'll be more than happy to, engage you. So we're going to start off, and Felicia is again going to start off just telling us a little about breast cancer from her standpoint, and then we're going to go to Jennifer after that.
Awesome. Thank you. So I think when we talk about breast cancer, I just want to start out by saying that this has been around forever. And although this is Breast Cancer Month, I'll probably dip out and just talk about just in general, since we're dealing with COVID-19 and everything, and people have not been taking care of themselves, maybe not doing their wellness check. I may digress, but let's just go into breast cancer. When you think about breast cancer, according to the National Breast Cancer Foundation, they're talking about this year alone in 2020, we're going to have over 278,000 women infected with invasive breast cancer. And then another roughly 49,000 women may have what we call ductal carcinoma or in situ cancer. So it's not invasive. It may be in the early stages. So we are talking to you because we want you to think about what can you do to prevent yourself from maybe having this disease, but more importantly, to detect it early enough. So let's talk about that breast. So the breast is broken down into really three parts: our lobules, our ducts, and then we have our connective tissue. And the most common breast cancer is in the lobules and in the ducts. So when you sometimes hear different terms, just want you to know, where do we find that? So when you talk about, well, what can I do as a woman? What's my risk factors? So, and you look at risk factors, we talk about a family history of breast cancer, puts you at greater risk for getting breast cancer. We say that a woman in general, even if you have no breast cancer, and a lot of women don't have a family history, but the average woman in your lifetime, 12.9% of the average women will develop cancer. And what does that mean, 12.9? That means 1 out of 8. So if it's 8 women listening to you, one of us, 1 out of 8, may develop breast cancer over our lifetime. So we talk about, again, ethnicity. We have women, they say in the studies that white women are at greater risk of developing cancer than African American women. But since we want to explain to African American women, that does not mean your risk is less. What we find with African American women is that even though you may not have a higher risk of getting it, when we get it, it's at a higher stage, a more advanced stage. And also because of African Americans, we may also have a hormone receptor type of cancer that is not more resistant to the treatments, HER2 or triple negative. And so then you have to have combination therapies to treat that. What are some other risk factors? We talk about age, increasing in age, although we are finding that there are some young women who are coming down with breast cancer also, so we can't say that. But of course, as you live longer, there's a greater risk of you coming down with this. There have been many studies that obesity has been linked to many cancers, not just breast cancer, but obesity in of itself puts you at greater risk. So again, while we're doing this COVID-19, and I don't know about you, but I put on a COVID 15 pounds. We got to be careful about what we're eating. We see numbers are rising. We may be locked down again. So I need you to begin to exercise, watch what you're eating. I begin to cut down my carbs, starting to exercise. All that is very, very important. What are some other risk factors? So we talk about studies have found that long-term use of hormone replacement therapy, drinking alcohol, more than 1 glass or 2 a day puts you at greater risk. We also talk about not having physical activity. So things that you think about, you're like, well, I'm locked down. When do I exercise? So even if you live, let's say, in a senior building, walking up and down the hall, go out your building, put your mask on, go up and down the steps, do something. We need you to try and stay as healthy as possible. So let's just say those are some of the risk factors. So what are the symptoms? And let me first start out by saying that 75% of the women have no symptoms related to breast cancer. So when everyone is thinking, I'm waiting for a lump, no, you're not going to always find a lump. So what may you have? You may see some changes in the color of your breasts. You may see nipple discharge. And again, if we're not breastfeeding and we're past that stage, there should be nothing non-milky coming out of our nipple. If you have been what we call outy, meaning you've always been a woman and your nipples have been always pointing out and now one turns inward, well, that does not mean cancer. But what's pulling that tissue inward? These are subtle changes that you have to pay attention to. And so I want you to be mindful of that. But inflamed breast, red, scaling, breast tissue, we say dimpling. When I look at the guidelines now, they're even telling doctors that the clinical breast exam is not something they're recommending anymore, as well as self-breast exam, because they don't think it reduces the risk of your death. But I would say to you, I still believe in you doing a self-breast exam. And we have the Reverend on the line. Let me tell you the truth. I don't even do my own breast self-exam every month, but I don't even care if you do it once a quarter. You have to know your own body. If it's not just your breast, just in general, you have to know your own body. And by doing the exam and putting your hands up over your head, when you do that or put your hands into your waist, you will literally see dimpling. So when women would come to see me or the breast surgeon, we would look at their imaging. But before we did anything, we would do a breast exam. And we would have them do those positions, hands over your head, hands into your waist, and we have them bend down. But literally, when you put your hands in, we can literally sometimes see the dimpling. So that is very important. I really want you to take, if you don't take nothing else, I really want you to take that away. Changes in the size of your breast. Again, by nature, all of us have one breast is a little bit larger than the other. But if you see one breast is really, really growing in size, that is very important to not ignore. I have literally seen women come in with hard masses that I'm thinking, there's no way you sat with that, or how did it get to be that hard and you didn't get a check? And I know that fear plays a large part in whether or not we seek care. But I want to admonish you to really don't be afraid. The sooner you get in and we can check you out, the better you are as far as us managing you. And then last but not least, some women will have a lump. Some. And that's what brings some women in. I had a young African-American woman. She was in her 20s. I remember I first started out in nursing, and she really did have large breasts. But she knew her body. And she went to her doctor and said, I think there's something wrong. There's something wrong. I need to be checked out. And he did his exam, but he dismissed her based on her age. Praise God that this woman said she knew something was wrong. She went and got a second opinion, and she got imaging, and she was diagnosed with breast cancer and got treatment. You have to know your body, because sometimes people are not going to always listen. They may not pick up on stuff, and depending on money, sometimes people don't have money. So you don't go and get the imaging, but I need you to examine yourself and pay attention. Let me move on from there. Let's say those are the symptoms. So now what's the main thing? Screening. Screening is very important. And that mammogram, which is an x-ray of your breast, is very important at picking up subtle changes. It may see a mass in your breast, but it may also see what we call microcalcifications. And that was something, if I walked away with nothing else from that time with that breast surgeon, when I had to go over with a woman, what that meant. And those are little calcium deposits in your breast. You will not see that on an ultrasound. It's only going to be picked up in a mammogram. Most women, particularly as we age over the age of 50, about half of us will have calcifications in our breast. That's normal calcium deposits. However, if a radiologist sees an atypical shape, an irregular pattern, or a cluster of these calcifications, that will warrant him or her to maybe say that you should have another imaging and or a biopsy of that area. And then we will check you out to make sure that those cells are not cancerous. The other thing is you may also have an ultrasound. There was a new law passed back in, around 2012. States started enacting the breast density law, because some of us, when you're doing that breast exam, some women have said the reason why they don't do the self-breast exam is because the breast is so lumpy, bumpy, they don't even know what they're feeling. I know that because I have dense breasts. However, the dense breastity law was enacted on May 1st, 2014 in the state of New Jersey. We were the 14th state to enact that law. And we're thankful to that, because a mammogram, although we say is great, it may pick up about 85% of cancers. So having that breast density law helped us, because for those of us who have these breasts that are very dense, and when they do the imaging, it shows up really, really light, it could be masked. So we had women who were being diagnosed later in later stages with dense breasts. And so that law was enacted to protect us. So I literally talked to my aunt the other day, and she said, oh, I just did my imaging and now they're making me do something else, make more money. And I said, no, they're not doing that to make more money. If you have dense breasts, they're doing that as a follow-up. And even though you'll get your mammogram report and it says dense breasts and you should maybe get additional imaging, I'm finding that some doctors don't really even push for that. They'll say, oh, the mammogram was normal. As I said, it may pick up 85 to 90%, but it's not absolute. So you get your extra ultrasound to make sure that there's nothing wrong with your breasts. And then let's just say you are diagnosed with cancer. The next step will be you working with your doctor, and then your doctor will decide whether or not you are, well, I shouldn't say, if you're diagnosed, you'll be sent normally to a breast surgeon. Sometimes when doctors first get the abnormal imaging, Your private doctor may work you up, but sometimes you automatically send you to a breast surgeon. So most of the time when women came into our office, they came in with just imaging. They had no biopsies. They didn't even know what the diagnosis were, but something was abnormal. We worked them up, did additional imaging, and then sent them on their way. I think I also want to talk about, for just a hot minute, men. We're talking about breast cancer, but men can also be affected by breast cancer. Although men don't have as much glandular tissue as women, every man is born with a small amount of breast tissue. And so men are also at risk of developing breast cancer. And if a man develops breast cancer, we do find that it is found in men older in age. 60 and older are at greater risk. If you have also, just like for women who have maybe a genetic link with some genetic mutations, maybe you have a mom, your sister, or aunt, we say that's a first degree relative who may have had breast cancer, that risk also impacts men. And we find that men are sometimes diagnosed even at later stages than a woman, because a man doesn't even think about breast cancer. He may see change in his breast and just, oh, it's a lump or it's some discoloration, but he is not going to think of breast cancer. And I'm here to say there are some men on the line that I want men to think about that too. If you have a history of liver disease, if you had, by some chance, some testicular surgery early in your life or a testicle removed, that increases your risk of also having breast cancer. If you had Klinefelter syndrome, there are several things. So I want men to also be aware of that too, that any change, a nipple discharge is not normal in a man also. So please keep that in mind. And I'll stop right there and see if anyone else has anything else to say, and then wait to see if there are any questions. Thank you for your time.
Well, thank you. Thank you. We're actually going to let, do you have any specific questions, or should we go to Jennifer and then come back? You're muted. So Jennifer, we're going to put you on, and you can make, your general comments. All right.
Thank you so much, Felicia. You made two key points. The first is you have to get to know your body, which is so important. And also the importance of, if you're not comfortable with your doctor, get a second opinion. We really have to be our best doctors. I'm wondering if I'm still on. I'm not seeing anybody. Oh boy.
Self alone. Go ahead. Keep speaking.
Okay. Okay. Sorry. Okay. So I must say I am a doctor. My background is in nutrition and wellness, and I have spent many years serving as a patient navigator with the American Cancer Society. But I am also a breast cancer survivor. And I really want to share from my heart this evening my experience. And I hope that there might be one person, even one person, who will use my experience and get checked. It is so important. I want to emphasize the importance of early detection. Early detection saved my life. And I was just very young. I was young. My story is just like many others. I thought I was too young to get breast cancer. I was just 33 years old, and I was at the top of my game. I had just recently gotten engaged to a fantastic gentleman. I was serving as a managing director in a very lucrative position with this company, and I certainly had no time for breast cancer. I did not want breast cancer. I was afraid of breast cancer. But guess what? Breast cancer had my name on it. So we also should remember that breast cancer does not discriminate. How it started for me, I knew my body. And it started with a sensation in my breast. And this was unusual. And the sensation led to pain and discomfort in my shoulder. I couldn't sleep at night. And then my breasts swollen, the left breast became swollen, and I knew something was wrong. I went to my doctor, and of course my doctor felt that this was because I was using the wrong chair, the wrong desk. I strained myself. I had fibrocystic breast. I did not know lumps. There was no palpable lumps. So I did not have breast cancer. I went home for the 3 months. I was tormented. I went back to the doctor again. And I got the same message from my doctor. And I decided that I need a second opinion. So I changed my doctor. And this doctor, I said to this doctor, I want a mammogram. I need a mammogram. I don't care how young I was. I was 33 years old. I want a mammogram. And luckily for me, my doctor decided to do a mammogram and a breast ultrasound. He thought that everything was okay, but the results came back that there was an area, a suspicious area in my breast. And my doctor felt it was because my hormones, I should come back in 6 months. But again, you have to be your best advocate. I said to the doctor, I need to do a biopsy. I need for you to go in, take out that area and check the area. And luckily for me, I stood my ground, and the doctor did the operation. He went in, he removed the area. He told me that everything looked okay and I will be fine. However, 2 weeks later, I was called to bring someone with me. Now, you don't want to hear that from a doctor. Whenever you hear take someone with you, you know that the message will not be good. And I went to the doctor. I was told that I had breast cancer. And I'm telling you, this is a scary time in your life. And I just want to pause because this is Breast Cancer Month. And this is a month that we'll be walking and raising funds for breast cancer. And, you know, I really want to reach out to anyone that's listening to, if you have been diagnosed with cancer, if you're struggling with breast cancer, if you have lost someone from breast cancer, I want to reach out with love and support to you today. Because when I got my diagnosis, I was confused, I was scared, I was emotional, you know, I felt my life going away from me. And but then I went into a fighter mode, and I decided that this disease is not going to win. I stood my ground. I promised myself whatever I needed to do, I would do this to save my life. So I started to research. I was in Jamaica at the time. I called the Jamaica Cancer Society. I went on the internet, and I just started to do my own research and became my own doctor. Next is the decision that you have to make as far as your treatment. And that also is a very confusing time for you as someone who is diagnosed with breast cancer, because there are different options that you have. You're young, no children, and I mean, it's very confusing. There's a mastectomy, you have lumpectomy, you know, and you want to save your life. My cancer, a lot of cancers, as Felicia mentioned, there are no palpable lump. I did not have any palpable lump. My cancer was under my nipple. A lot of cancers, you find them in the chest wall here, in your breast is a palpable lump. I had no palpable lump. It was hidden under my nipple. So I decided that I needed to do a double mastectomy. That's what I wanted to do, because I was not defined by my breast, and I wanted to save my life. However, my doctor convinced me, and I decided to do a mastectomy. I was a young girl at that age, and that was a decision I made. I was happy with the decision, and I had support from people. You know, my fiance at the time, he was very supportive, and I did a mastectomy. Now, the emotional part of it is, you know, something that you need a team of people to support you, because it's a very emotional time for you when you go through the diagnosis and the treatment. So what I did, I decided that I needed just positive people in my space. I just need healthy thoughts. I need just prayers and love at this time. So I made a decision to screen the people that I brought into my space at that time. I also took the decision to change my job. I wanted to go home. I wanted to fight. I went into fighting mode. Nutrition was big for me. So I wanted to strengthen my immune system because when you're diagnosed with cancer, you know, you have to make sure the body is ready to fight that disease and the cells, are nourished and ready they're healthy and ready for you to win the battle. So I changed my diet. I changed everything in my life. I rid my body of toxic people, toxic things, toxic food, toxic energy, all of that. And I went home and I decided that, I need some healing time for myself. And that was what I did. And initially, it took me, I would say, about 2 weeks before I faced the public. I stayed home with people that loved me and played good music. And I went out after 2 weeks. I was back at work and I started to tell people because I felt that I cannot shut up about this. This is something that I needed to share with people so they can, take preventative action. Interestingly, I found that a lot of people who were close to me had the disease and they had hidden it from others because you will find that the people deal with the disease in different ways. Some people don't want to talk about it, some people don't want to face it, and while others will share. And I just started to tell everybody about it. I wanted to help more people. So I called the Jamaican Cancer Society. I was living in Jamaica at that time, and I tell them I wanted to help, and I became a member of the Reach to Recovery in Jamaica. And the Reach to Recovery, they support people or patients going through cancer. And I started to go out to schools, to workplaces, to the hospitals, and work with people and talk to people. I migrated to the US, and I have been here for a little over 20 years, and I've been a part of the American Cancer Society Trust to support breast cancer persons undergoing breast cancer diagnosis in the hospitals. So I've been a patient navigator for about 15, 16 years now. But my message to people is breast cancer does not have a face. It does not have a name. As Felicia mentioned, 1 in 8. You don't know if you will be 1 in that 8. You will be the 8th person to get breast cancer. As long as you have breast, you can get breast cancer. My breast cancer was invasive ductal carcinoma. Okay? And that means if I did not take early action, that was what saved my life. There are different breast cancers. There are breast cancers that, as Felicia again mentioned, that are inflammatory. So you're going to see them and you would not know that you had breast cancer. You'd think that something is wrong with your breast. So the awareness is very important. Whatever you're hearing today, it's okay to listen and hear, but what we want you to do is to share the information. We also want you to take action, take early action. This is Breast Cancer Month. I don't want you to put it off for November or December. Make this a gift to you, to yourself, and get that breast check done, get that mammogram done, whatever you need to do to save your life and to be here for your family and your loved ones. You need to do that. Thank you. I'm going to pause
Thank
now.
you. Thank you. Thank you. All right. Awesome. Awesome. And it's just, we really like that personal story because the point there is that, you see from that is and I think even though I think Felicia's mentioned, some people saying, whether self-breast exam is that great. Listen, if you have a feel for your own breast and you're going to know when there's a change, You will know when something is different, something's out of the sort. And a good pointer, you don't have to be, the basic screening starts at 40, but you don't have to be 40. If you find something, you need to talk to your doctor. And then the other pointer that I picked up that was good is, you know yourself. So even if a particular doctor is trying to just brush you off, well, you brush them off and find somebody else and talk to,
Yes.
so that you can, really get, taken care of. Overseer, any particular things you want to bring up or question at
Yes,
this time?
yes. This is part two, and Felicia and Jennifer, really want to thank you. The common theme I'm hearing from both of you and our previous callers is the body, the mind, and the spirit. And it looks like you spoke about removing those toxic people that were around you. That would actually pull down your spirit. And it was important that you've surrounded yourself with folks who had a positive outlook. And Felicia, you said the same thing, similar. You weren't accepting this disease. And as you described that as long as you have breasts, you can, or 1 in 8, 12.9%, could likely receive breast cancer. But you drive home the point. Early detection is crucial. Early detection is crucial. Now, Felicia, can you talk to, because you said there are times when you don't detect it. So what signs should they look for to get screening? Some ladies will not do mammogram. Jennifer, you mentioned in your 30s, studies say you got to do it in your what, 50s, 40s? But how do you know that you got to go get a check?
Well, I mean, the bottom line is the regulations are the new guidelines are, we used to say a woman 40 and over got mammograms. And then they changed the guidelines. Now there are still people saying annual mammograms at 40, but now they're saying also American Cancer Society, even themselves saying at 45, between 40, 45, you can get screened, but everybody over the age of 50, that now they're recommending every 2 years. I don't necessarily agree with that. The U.S. task force used to help set the guidelines, but most of them say annual screening still at 40. But the great thing is listening to Jennifer's story. I mentioned one of my patients when I first started out nurse, she was in her 20s. Miss Jennifer says that she was 33. So the bottom line is, and I don't know, because I don't remember if Jennifer mentioned or had family history. Most women who have breast cancer don't have family history. So if Miss Jennifer didn't have family history and here she is 33, that's why the doctors did not take her comments as serious. Even though she said it, I praise God that she fought for herself. So the screening we say is at 40, but again, it all depends on each individual woman. So if you have that family history, as I said, a first degree relative, an aunt, a grandmother, your mom, your sister, anybody on your side of the family, even dads. We always say mom, but first degree relative, even on your father's side, that can impact you. We get 2 genes, one chromosome from dad, one from mom. So that impacts us. And then the whole thing is knowing, like I said, knowing the breast. I disagree with them telling us no longer to do that self-breast exam. And that's why I was saying, no, you should examine yourself. Check yourself out, because as Miss Jennifer so pointedly put it out, she knew her breasts. And she was saying, there's something wrong. Oh, and he told maybe the chair you're sitting on, just dismissed her because unfortunately, and no offense to the men on the phone, on the screen, sometimes people don't listen to women. And they may think we're hysterical or you don't know what you're talking about, but you have to know your body. Jennifer, you want to jump in and say anything that I may have missed on that?
Yes. You are so correct, perfectly correct. I have lost, there are so many people I have lost, and all of these people were under 40 years old, so many. And just working with the patients and the hospitals, a large portion of percentage of diagnosed patients are under that 40 years old.
That's right.
So I do agree. Maybe you can touch on the lymph nodes as well.
Yeah, just before
Felicia.
just before we do that, I really think we want to drive home the point of early detection and
Yes.
self.
Yes.
I mean, I know all these task force say that. Now remember now, when all of these the guidelines and all of the stuff are being made, is more they're putting a financial spin on it. So it's more
Right.
like they're looking
Yes.
at cost effectiveness. So they're not really
Yes.
looking at quality of life or anything like
No.
that. The guidelines are made because, like, if we do 1,000 and we're only going to find one, and we spend so much money to just find one.
That's
That's
right.
what they're looking for. So I want us to,
Absolutely.
then we now have to take control of our own lives. And it's so, so, so important that everybody,
Yes.
I teach the girls once they are pressed to do the breast exam. I mean, I'm a family doctor,
Yes.
by the way, for those who don't know. And so,
Yes.
and the other thing is, which I want to point out to all you, especially the West Indian people on the line, stop, trying to say, well, the doctor knows best. Or the doctor, a lot of them come in and say, whatever you say, doctor. I don't want to hear whatever I say. What do you think? It's your body, it's your life. And I tell
What's the
people,
body
Yes.
saying?
you live with yourself 24/7, and you see me for
Yes.
15 minutes. So who's going to know you
Right.
best? So I think
That's
all
right.
of us
There
have to
we
take
go.
that personal responsibility for ourselves.
Yes.
And and last week we pointed out, remember, overseer, that your family history. I gave homework last week. Hopefully everybody took it, to go and call up
Yes.
all of your relatives, anybody who's alive, get all your family history together,
Yes.
and somebody in the family be that record keeper. So anybody said, "Hey, is this in your family?" Because so much we can learn from the family history. All right,
Absolutely.
all right. Anything
Absolutely.
else before we
Absolutely.
go on? Go ahead.
No, I think that's very critical. Knowing your family history, knowing
Mhm.
your family history,
There,
and the
definitely.
point you both made. You got to be assertive.
Yes.
You cannot take the doctor's word. Your breast looked like this, operated like this, but now it doesn't look the same.
That's
And
right.
as much as the doctor may misdiagnose you, go get a
Right.
second opinion.
That's right.
Go get a
That's
second
right.
opinion. And don't
Yes.
be shy about that. And let me put this point in. I'm glad for those who have insurance, because without insurance, then you pretty much your hands are tied.
Right.
But
Right.
if you have insurance, definitely. So yes, back to
Yeah,
you.
well,
Well,
yes and
yeah,
no.
overseer.
One second. Let me speak to the no insurance, because also that's important. Then we're gonna come to you, Felicia. But the good thing about that, even there's still some good things in America, and one of the things is you should be able to get covered even without insurance with anything. And a lot of the states have programs, even for free mammograms programs. So make sure you do your homework. Go to listen. If you don't have insurance, go to social service and beat down the doors. You got to stand up
Definitely.
and take some action, because there is help out there. Okay, Felicia, pick that up.
Right. Thank you, doctor. So I was going to say the same thing, that between federally qualified health centers, I don't know where you live, but most states have a federally qualified health center, and they can help you with that. Charity care in most states also, if you're under a certain income level, you can get imaging. So that's not an issue. And as he said, there are places doing free mammograms. So that should never preclude you from getting your test. I think the main thing is that, again, people live under that assumption that you have to fill that lump. I really want you to understand too, as we said, you may not have that mass. So don't be waiting for a lump. I don't feel nothing. I mentioned to you the microcalcification, those spots, and you would only know that or see that if you have a mammogram. If that mammogram, like we say, picks up those calcifications, then you will get additional imaging. Sometimes a mammogram will pick up a mass, but if not, they will do an ultrasound. So an ultrasound uses the sound waves to pick up a mass, and that's great, but that goes hand in hand with a mammogram. The main thing is, as we say, looking for symptoms. Again, what can we say? Changes in the size of your breast, one bigger than the other. And again, most women, we always a little bigger, but I'm talking about a major change. As Miss Jennifer mentioned, some swelling that she had not seen, red or hot breasts. The inflammatory breast cancers present. They come and looking red, or we sometimes say orange peel. It almost looks like an orange pill, and it's puckered. And when I saw one lady, she came, her breast was so edematous, so swollen, but you could absolutely look like all these little puckered marks in her breast. Unbelievable. And she sat with that for a while. And for her, it was due to lack of insurance, but that was not an excuse because, again, you could have gotten it for free. It was fair. So we want you not to be afraid. If you see something or feel something, don't be afraid because the earlier we find you, breast cancer is in stages, right? From stage 0 to 4. Stage 0 is normally a ductal carcinoma in situ. It's not invasive. It's still in that duct. We can treat you and normally take care of that without any problems. But once it becomes invasive, now it can spread to other parts of your body. So even when you're doing your breast exam, what do? We tell you, I was talking about positions, but we also tell you to start up here in your axillary area, feeling here for your breast tissue, and then you come around and do your breast in the position of a clock, or you can do the wedges, whatever's easy. We need you to take that 15-20 minutes to examine your breast and then squeeze the nipple to make sure nothing's coming out of it. Okay. But if you don't walk away with anything else too, please understand you may not have that lump, but the mammogram is going to pick up whether it's a lump or maybe calcifications, but can also be, as we say in women, greater than 50. Most microcalcifications are benign. However, if there's an atypical cluster or irregular shape, the radiologist, who is a doctor, a trained doctor, will say, hey, you need more imaging. They may have you come back in for a diagnostic mammogram. And then if they're not happy with that, they may offer ultrasound, MRI. There are so many things out here, even magnetic breast imaging. I didn't go into all of that because it depends on what area you live in. 3D tomosynthesis, I did that for my dense breast, but that 3D tomosynthesis is expensive, close to $7,000. Had to fight with the insurance to pay for it. And unless there is a true family history or a greater risk for you, that is not something that you necessarily have to have. That mammogram is your best defense, as well as an ultrasound if you have dense breasts. And like we say, if nothing else, you knowing your body. And that's for women as well as men. If I don't walk away with anything else, we've seen men with breast cancer. Had a couple of men come in while I was working with my surgeon. And thank goodness, the couple men we had did not end up with breast cancer, but they were surprised to even, and I think embarrassed, like, I shouldn't be in here. You're going to do a mammogram on me? Yeah, a man can get a mammogram, and we'll do scan and ultrasound on you also to see if we see a mass, the same way we do for women. So the bottom line is you just have to know your body. You have to know your body and get treated.
Can I say a little bit more about fear? And,
one second, Jennifer. Jennifer, hold a minute. Just answer this question while you make your comments. On the line, someone said, some is afraid of the mammogram test and why. So you're going to wrap that in your answer, okay? Yeah. Okay. Go ahead, Jennifer.
Right. Yeah, this is a big topic, the fear. And we have been seeing a lot of patients afraid they feel a lump and they will not come in. And we have to remind them that a lot of these lumps are benign. They are not malignant. They're not cancerous. And if it is malignant, it's not going anywhere. It's going to stay right there. And by the time you go to the doctor, it may be too late. Secondly, we have had patients who have been diagnosed and disappear because they're afraid to face what if. Now, the same answer applies. If caught early, the early cancer is caught, the better will be your chances of survival. So don't be afraid. The doctors, and there are so many different doctors and surgeons and cancer society and people have gone through cancer that can give you the support that you need. The American Cancer Society, for example, they have a lot of programs that you can go on the site and navigate that can support you at whatever stage you're at in your cancer journey. A lot of people are afraid about the mammogram because, one, they feel that, they hear what you hear, radiation, too much radiation, but mostly because they feel it is painful. And usually it is somebody else's story they're buying. Don't buy somebody else's story because it might be a little painful for you, but it might not be painful for the next person. Okay? And I mean, cancer is more painful than a mammogram. So you need to weigh the pros and the cons. You know, you need to find out if you have breast cancer, and whatever it takes, you need to do that. And it's better to do the mammogram than to do the chemotherapy. So it's a matter of choice.
Yes.
Alicia, going to say anything about that?
Yes.
The fear
No,
about doing
I
the mammogram.
I listen. I mean, I totally agree. Listen, that test is no joke. I can't spoon feed it. It is uncomfortable. Forget about it. I hate it, but it's a necessary evil, and that's what I say.
Yes.
I always, when I do it, I'm saying some man made this machine to squeeze my breast, and you know, that's what I always
That's
say to the
true.
women when I'm in that room. However, I agree with Jennifer. I have to make it light, but in all seriousness, as we said, to not do it does not help you, because that mammogram is your first defense in getting detected if we need to. If it can pick it up, you need to have that mammogram. And then if any additional imaging is going to be done, it's going to be based on that mammogram. So, some people really refuse that. And we've had some women who said no. And it's very, very rare that women come in with such small breasts that we can't squeeze it. And then you may have a doctor do the MRI or ultrasound. It's very, very rare. But that mammogram is your first defense. Get over the fear, because as Jennifer said, if you end up with cancer, the stage you'll go through, and depending on treatment, if it's advanced, you'll be kicking yourself thinking, I should have done something earlier. And we're not here to put fear on you. That's for all of us. I still get
Yeah.
mammograms. I'm 54 years old. So I get a mammogram. It's uncomfortable for a few seconds. And now they even have padding they put on to make it a little better for you. So they are getting better and trying to make it a little bit more tolerable, but you're holding your breath for like 20 seconds and you're done. Two clicks, you're done. That
Let,
is
let,
not
let me
something that should hold you up.
That
let
might
me
Yes, just
save
let me
your
one,
play
life.
devil,
Yeah.
one
Bishop.
point on
Let
that.
me
Go
yeah,
ahead.
let me play the devil's advocate, right? Let's say you are so much crippled by fear that you do nothing. You do nothing. So let's talk about the stages. And I know it's unique to your body type, your weight, your age, but let's talk the stages. So if it's in stages 0 and I do nothing, if it's stage 1 and I do nothing, what is the plight of such a person? Because that's where they live. I rather not know. Because if I know, then I may accelerate my path to death, because emotionally I become a drain. I start worrying, I start fretting, but not knowing
Or,
I'm
yeah.
living a much better life. So, what is the likelihood of someone in stage 2 not doing any mammogram, not knowing it becomes stage 4? And what does early detection really help? I'm playing the fear factor here because it's a safe
Okay.
zone for many.
Well, the early
Yeah,
detection really is gonna help you to most likely find it in the lower stage. And of course, in the lowest stage, it's much more likely that either just a lumpectomy or a mastectomy will be cure, and maybe a little radiation. You may not, I won't have to have chemo. Now you get to stage 2 and above, and you find it that stage, and then of course, if you go to stage 4, and somebody was mentioned before, you're talking about spreading to the lymph nodes and to even distant organs, and really that's a death sentence. So as much as you can, you want to catch it in the earliest stage. Therefore, you'd have the less amount of treatment that's going to be needed. Stage
Yeah.
0, you could basically have a lumpectomy and you'd be done. Versus stage 4, where you're may still need a mastectomy to debulk, but you're gonna have to have your lymph nodes all investigated, and actually maybe that time you may have metastasis to the lung, to the liver, and so you're really talking about a major thing. So I know it's better you deal with it in stage 0 and then get the support that you need, for the
Right.
emotional support, the mental support, and all of that. It is really much better. And one of the things that I tell people is I kind of know my patients. So if you have poor pain tolerance, you can pre-treat them with some ibuprofen. It actually helps, and it actually helps, those people. So and it's kind of the preparation. So the main thing is talk about things. if you're afraid of something, tell somebody. All right? Because, for example, me now, both as a pastor and a doctor, I can help you quite a bit to quell your fears and to help you emotionally to even to prepare you to go and get a mammogram. So I think it's
Yes.
really comes down again to communication and talking about it. Okay, others can jump in on that question. Felicia, you
That's
want to
true.
say anything on that?
Yeah, I think that you really hit it on the nail. That early detection is so important. So I think the other bishop was asking about how about progressing from stage 3 to 4. We don't know the time frame. I can't. Everybody's an individual. We can't tell you how long that's going to take. But most of the time, we catch the cancer early. It can be treated. Please understand that most women who are diagnosed with cancer, Jennifer is still a living witness that here she is years later, right? But she got diagnosed at 33. We say if you have breast cancer, that it can reoccur or have other complication that first 5 years. So we watch these women. We do have them do diagnostic mammograms for the rest of their life. We're staying on top of them to make sure there is no reoccurrence. Sometimes also based on your stage, if you had lymph node involvement, you may need to have chemo or radiation. Also depends on your hormone markers, as I mentioned, without going into too much detail. But sometimes, particularly for African Americans, if they have a triple negative cancer, which is not receptive to the estrogen or progesterone or the HER2, these are women who now need different combination therapies to treat their cancer. Women, and particularly, unfortunately, African American women sometimes have a higher risk of triple negative cancers. And they say that we have less than a 70% survival rate. So when we talk about cancer, we have stages, but we're also talking about your hormone, your tumor markers. And that's without belaboring and getting too in depth for people. I want to keep it somewhat simple, not so much to dumb it down, but the bottom line is let's hope that we can prevent you from even getting that cancer, or if we find out we're catching you early enough that we can treat you with a lumpectomy, a mastectomy. If you say, well, because some women like Jennifer, I really appreciate her saying she was not that concerned about her breasts, but there are some women that their breast is everything. And you talk about cutting off a woman's breasts. She talk about depression. These women really suffer because they're thinking, I'm not a woman. What's my husband going to want me? I had a friend of mine tell me that his wife did not want him to see her. And later on, they end up getting a divorce. And a lot of it was her body image stuff. But there's a lot we can do. There's reconstruction surgery. There's so many things, but each woman is different. Jennifer, you want to say anything about that?
Oh yes. One, I was telling someone just yesterday about reconstruction, and people without breast cancer now they're doing reconstruction because of botched surgeries. So I mean, years ago when I was diagnosed, you did not have that. Now it's so easy and it looks so real, to do the reconstruction, and it's like nothing happened. So do not let that fear. I always say to people, and I'm not here giving advice, but that it's better to live. It's better to live with one breast, no breast, a lumpectomy, than die with two good breasts. And I really have to, as a survivor, I really have to tell you as it is. It's best to take whatever treatment you need to get. You need to do that to save your life. And as I said before, you need supportive people in your corner. And if you're not getting it, seek out supportive people, your pastor, your doctor, your teacher, if you're in school, seek out people who can support you, because it is an uphill battle. It's a devastating time in your life, and you really need the help. You really have to fight for yourself first, and hopefully you get the support that you need. And I always have to recommend the American Cancer Society. They have source there. They have patient navigators that they can match you with people, who can give you the support you need. There's Gilda's Club, so many different organizations that can give you the support you need. The key is we want you to win at all costs. And I also want to mention that one size does not fit all with breast cancer. And A lot of times patients want to use another person's treatment, and apply it to their situation. You cannot do that because you did not get all the story. Breast cancer, everything depends on the type of cancer, the stage, and your age. So you have to work with your medical team, and they will give you the best treatment for your particular diagnosis. It's very important.
Yes, yes.
Yep,
And I want to say
very
one
good.
other thing. I want to make one other comment too. If I had not worked with that breast surgeon, the one other thing I would not have understood, and I really want the people listening, because I think that some of the young folks and women don't understand that when I did not understand the importance of taking, again, really good care of our body. So when I'm saying that is that, unfortunately, we live in a world where everyone wants to look fabulous all the time. And women are doing a lot of reconstructive work. So you want new boobs, you want to have that tummy tuck, you want to do all this stuff, in particular the tummy tuck. What I found out was that for some women, when now we want to maybe do breast reconstruction, and maybe you want to use your own body fat, if you've had reconstruction, particularly a tummy tuck or anything like that, the doctor cannot pull that fat because now it's scar tissue, it's fibrosis. He cannot use that. So sometimes they have to pull fat from somewhere else. But a lot of times, the stuff you're doing now, because you're not thinking about what may happen later in life, so you do look fabulous. Girl, you took that tummy down. But God forbid you get cancer later in life, and you're maybe not excited about putting silicone or something else in your breast, and you could have maybe used your body fat. I really want you to be mindful of things you do to yourself. Try and keep everything intact. Take care of yourself. Even some women who had a serious smoking history, the plastic surgeon refused to do surgery because one woman, although she was diagnosed with breast cancer, she refused to stop smoking. And so he said that she was not a candidate. So there are certain lifestyle things that you do that may put you at risk for, as we say, for different types of cancers. But if you can just think about taking care of yourself, eating healthy, you can do everything right. Let me just say that too. You can do everything right, and cancer may still come for you. We don't know all of that. We don't know why you're the only one in your family with breast cancer, or you ate right, you're a vegetarian, you do this, you do that, and you still get cancer. That's with anything. Unfortunately, that's life. And each of us have a journey, and certain things are going to happen to us that we, as medical people, doctors, nurses, we cannot answer all of that. However, I love that Jennifer said your team will help you. Gilda's Club is a great group. They even have a minority component to Gilda's Club. I have a colleague of mine. We both went to HBCUs, historically Black colleges, and they started a group because when she got there, predominantly a lot of white women, and she wanted to see more people like herself. And my surgeon and I went and participated with them and went to Inglewood, and we talked. And then they also presented for my Black Nurses Association. So there are several groups out here, Sisters to Sisters, women of color, who will share their story. And as Jennifer mentioned, American Cancer Society, they have people in different groups that even take you to appointments, help you with cab services, so many things we could talk about. But I knew that we didn't have all that, so I didn't put all that in there. But there are people out here to help you. The main thing is early detection. And as we say, this
That's
is
it.
breast cancer month for any month. Yes.
Pastor, Overseer, I have a little kind of controversial question, more for the Christians. Now,
Okay.
what do you say to the people who believe God, who says, all right, I'm not going to get a breast mammogram, I'm not going to check myself, I'm not going to get anything because God's going to take care of me anyway?
Very good question. And you get that a lot.
I didn't hear.
You have,
Could you repeat it?
I'll repeat the question.
Break up a little bit.
I'll repeat the question for those. I'll repeat the question for those people
Go ahead.
who said, well, I trust God, I believe in God, I'm getting no testing, I'm getting no workup, I'm not getting because the Lord is going to take care of me. What do you say to those people?
I would say pray that the Lord. I would say pray that the Lord also gives wisdom, and pray that the Lord will direct and guide the surgeon. That's a better thing to do. Um, because the wisdom is to go get yourself checked from a doctor who is also God's child. You know, my God would tell me to use my wisdom. So it depends on what you're hearing. You
Okay,
know,
good.
that
Well,
would be
well,
my
Felicia,
wisdom.
Oh no,
Felicia.
I'm waiting for the overseer. I'm gonna come after the overseer. Go ahead,
all right.
overseer.
I go get overseer. All
Well,
righty.
Felicia, let me take this one because that is a common.
Yes,
There are some members in the
yes,
ministry that do not take medication, do not believe
yes.
in taking any type of advice from doctor because they believe that the greatest doctor is Jesus. Now, let me give you a scenario. The Bible said there were 10 lepers, right? And they were covered with leprosy. And they came to Jesus. They should have been quarantined, by the way, right? Just like the pandemic. But they saw Jesus and understood that he was a healer. So they did what anyone who is desperate would do. So they came to Jesus, and Jesus healed them of their sicknesses. But here's what he told them: go show yourself to the priest. Now, the role of the priest there was, it was like a medical examiner. That's the only person who can tell the time of death, the cause of death, and so on. So even Christ himself recognized the role of the priests, the role of the doctors. Another example, the woman with the issue of blood. For 12 years, she was hemorrhaging. And the Bible said she sought many doctors. And when her insurance ran out, when she was financially broke, then she became desperate and she heard about Jesus. 12 years, at that time, Jesus was only 18 years old. His ministry didn't start yet. So God was preserving the doctors. Let me not say God. The doctors were preserving her until she met Jesus. So for those who do not want to take advice from the doctor, I would really sit you down and encourage you to listen to the science. Let me digress for a bit. You saw what happened in the White House. Let's not get political, but the science says wash your hands, wear a mask, right? Social distance, and you have a high probability of not containing this virus. And for those who weren't, you saw how quickly they became contagious. So listen to the doctors. They are God's handmaid, and God has placed them here on this planet to help our wellness and our wholeness. So I
Yeah,
think we
and
ought
I
to do better.
and I asked a question because you know where I come from. Bishop knows,
I know where you
Pastor
come from.
knows,
I know where you
I'm a,
come from.
because I'm a bishop and a doctor. So it's really clear to me that, and the reason I brought that up, I just wanted to make sure we reach out to everybody because there's those people
Yeah,
who don't sometimes touch that. There's no knowledge, there's no understanding that man has that didn't come from God. And my contention is, if the Lord, laid things out for you to figure out, you don't have to go and pray and ask Him about it. He lives, the knowledge is there for you to get it, for you to attain it. And you need to trust God to lead and direct you, to the right doctor. Because don't get me wrong, as we said before, that you got to take that, be forceful and take that responsibility for yourself. But you need to seek out that good advice that the Lord has already laid out there for all of us. And I just want to encourage everybody that is here listening today. Early detection, as we're saying, that's the main point we're making. So we're encouraging everyone to
Okay.
get your family history, get everything in line, know where you're from, who you're from. I even did I'm West African actually. I did my genetic thing. Just I encourage everybody just trying to learn as much as you can about what God has given you. God has given us this body for us to take care of it. Learn as much as you can, and then take the necessary steps with the knowledge base that God has given to man to take care of yourself. One point I think everybody made, which I want to reiterate, you can eat healthy, and you may still get a cancer. However, if you're not healthy, you're less likely going to survive. If you're
yes, your
healthy,
immune system is
and
compromised.
you're
Yeah.
eating balanced and you're doing that, then your immune system is going to be more robust. Your whole defense system going to be more robust. So we're stressing that as well, because I do preach healthy living as a source and the guidance for everything that we do. And we really, really, really and truly appreciate Felicia and Jennifer for your great input. I think it was really telling. We thank you for the personal information that you gave out, because hopefully people can understand that this disease doesn't respect anybody. It's kind of like the pandemic. We'll to touch on that briefly in a minute. It doesn't really matter who you are. If you lay yourself out there with the pandemic, you're going to get caught. And in terms of your body, if it gets caught with cancer, you want to find out early. And it's breast cancer, but it goes with everything else. So there's basic screenings that is recommended for everyone. We'll probably do a program, and we probably could follow up on that soon, just the basic screenings that we need to do just in general, to catch everything, the different type. Because if you do that, not that you won't get the disease, but you're going to have the knowledge and you're going to be able to take care of it early. So we appreciate you, Felicia, for all that you do and for really taking your time. Jennifer, we thank you for really just sharing, and we really appreciate your input. And I'm sure people got a lot out of it. There was a lot of comments, good topic, important information, and it really was great. But Overseer, your last word, and then let's go to the lady.
Yes. And Bishop, I echo, for both of you to be able to be comfortable in your skin and to tell that story. Believe it or not, we had a hard time getting a man on. It was easy. Trust me, I've been trying to get a brother who has overcome. The brothers don't say we survive; we say we overcome. So it's a different terminology. We overcome cancer. So it's hard to get a male on to say whether prostate, whether breast, whether intestinal, whatever type of cancer. But I thank God for you, because, as Bishop said, if you look at the comments and go back and look at it, there's so many people that are being helped. And let us continue to spread the word. Bible said, my people are destroyed because of lack of knowledge. And there's nothing else we're doing right now. We are exposing. And I can see a 14-year-old daughter with breast and saying, Mom, can I talk to you? And, should I really examine my breast? And we learn, as long as you have breasts, yes, do the examination. So thank you, ladies. I appreciate you for coming on, and continue to do the great work that you do. Amen.
All right. Blessings all. We thank you again. And for all our listeners, remember, it's time to vote. New York, you can start voting in person.
We started
New
today.
Jersey. Yes. Yeah, New Jersey, where actually,
Yes.
I actually got my card. I got my card back in the mail today from my county that said we got your ballot. So so New Jersey I didn't realize they're going to do that. They're even telling you that they got it. So we got a card right in my house that where your ballot was in.
You're making me jealous. I'm going to vote tomorrow.
For those in New Jersey, you can actually go online. Actually, just Google it, and you can see if your ballot was accepted. You mailed it in. It's amazing. So all those people are telling you that, trying to scare you that this is not going to work. I know New Jersey have these drop boxes. You don't even have to put it in the mail. Each county has boxes. Listen, do whatever you can. Vote from your heart. I'm not going to tell you who to vote for, but vote from your heart and really put some prayer into it. This is one of those things I think you could pray about and ask God for your direction if you're not clear, because we're going to need to do something for this country and to save everybody around. So God bless you all. The census, I think, is wrapped up. I'm not sure what's with the census anymore. One day it's going, one day it's stopped. I'm not even sure.
Yeah, the court kind of pushed it back, so it's kind of closed for now.
Closed for now, but it may open back up. But everybody be responsible, live healthy, and with this pandemic, all I'm going to say to you, don't listen to any rhetoric from anybody. You take personal responsibility for yourself. Protect yourself, and in so you're going to protect others. So God bless everybody. Have a wonderful rest of the weekend. God bless you. God bless you. God bless you. Thank you all. Thank you.
Bye-bye.
Turning Point family, what an awesome time we just had. To all our first-time guests, we truly appreciate you for joining our live broadcast. We would like to hear from you, so please send us your comments, questions, or testimonies of how this program has impacted your life. Our email address is info@pflmi.org. Finally, if you feel led at any time to give to this ministry, please visit us at pflmi.org and click on the tab for donations. You can also give via Cash App at $PFLMIORG. We're looking forward to meeting with you live on next week's program. Have a blessed and prosperous weekend.